Welcome to the Reimagine Patient Engagement Podcast. This podcast aims to answer the changing dynamics in patient engagement. What role does technology play in the space, and what are the key initiatives and metrics each individual in the ecosystem expects? Let's get started.
Welcome to Reimagine Health. My name is Donna Rice, host of these podcast series. Today, we are thrilled to be joined by Dr. Jaclyn Albin. Dr. Albin is the director of Culinary Medicine program, which aims to teach nutrition to students, healthcare professionals, and the community through hands-on cooking classes. She is also the Associate Professor of Internal Medicine and Pediatrics at UT Southwestern, Dallas, Texas. She is also board certified in lifestyle medicine and is a certified culinary medicine specialist. Wow, Dr. Albin, you have such a passion for nutrition and you're so involved in the Food as Medicine program and the whole movement. Can you share with our audience your journey into medicine and how you've really become such an advocate for nutrition?
Thank you for having me today, Donna. I really think that my interest in medicine goes back to being a little girl. I get teased by family members for having asked everyone for Band-Aids and tissues to make medical kits around the house when I was about 3 years old. And then my grandfather was a farmer, and he was always taking me out, showing me what he was doing. I have pictures on his tractor. And I think the value of knowing where food comes from was core to my childhood experience. So fast forward to medical school training. When you're in the midst of training, you don't think about the things you aren't being taught until it's missing when you need it. And so I think that was true for nutrition, that I go through medical school and residency. I'm in my residency, and my husband at the time, who I had met while I was in medical school, he's not a physician. He was really sick, and his medical team had difficulty discovering what was going on, ultimately gets diagnosed with celiac disease. And I remember walking out of the physician's office, and this is about 14 years ago, before it was easier to get help for celiac disease. And I looked at him and said, I don't know how to help us. I should know this. I don't know what to do. And they didn't tell us what to do. So that was the beginning for me of the disconnect of being able to help my patients in nutritional care and my education.
Awesome. And you talk a lot about nutrition and health and the benefits of nutrition, and it's something that, like you said, in medical schools they don't talk about. They're not taught about nutrition. And I love the term food as medicine. I think it's beautiful, and I think it's so important today. Can you tell our audience exactly what the food for medicine or food as medicine movement is all about?
I think it's important to start with saying this, to use an improv phrase, this is a yes and approach to conventional medicine. This is not saying that we no longer use or need conventional approaches to medical care. It's about saying we've been missing a piece of what sets the foundation for good health. So I think that's vital. I'm not telling you, let's eat away all of your medications or all of the other things that you might need. So the reality is that everyone needs a healthy relationship with food, which most Americans don't have. And so at the most foundational level, it's food as medicine is population programs to understand and access healthy food. And so for some communities, that's education. And for other communities, that's going to be actually having access to nourishing food. Because when you think about our structural and social determinants of health, including food insecurity, many communities that lack adequate transportation, access to grocery stores and fresh produce, can't even get the foods their bodies need to thrive. So the next layer of food as medicine is connecting people to the programs, and our federal programs and state-based programs like WIC and SNAP benefits, school lunches. Those are the safety net programs that try to bridge the gap. And then it's a pyramid when you think about it. So it's what does everyone need, which we've started with that. And then how do we move up the ladder? So moving up the ladder, or the pyramid, if you will, of food as medicine interventions really begins to be tailored to individuals. So everyone needs access and education. Then if you have diabetes or you have chronic kidney disease, you need specific guidance that will support that health condition. And what that looks like is going to vary based on your cultural background, how much you cook, your educational level. And so we really like to triage and meet people where they at with a food prescription. And that's where this becomes part of medicine, is that you should have a medical team assessing your unique story, your unique health condition, and then getting you plugged in with the right resources. And that might mean a cooking class. It might mean prescription for fruits and vegetables, or even one of my favorite interventions is kind of a medically tailored HelloFresh concept, or, any of those meal delivery kits where you actually get a recipe and the set of ingredients to prepare that at home. And then at the highest level is medically tailored meals. Those have gotten a lot of media attention, where pre-made meals are actually covered by some insurance plans now.
Right. You talked a little bit and touched a little bit on the gaps we see in both kind of food and nutrition security, especially with COVID. I think COVID uncovered so many issues, and I think it really brought to the forefront kind of some communities and the food insecurity that exists there. Can you touch a little bit more on a federal level, some of the actions or some of the things that are being done to really impact care? Because if you look at, we're like third world countries in some of these communities. And I mean, we both are in Dallas, and just looking around some of our areas, we see it every day.
Well, I think it's first important to distinguish food security from nutrition security, because nutrition security is actually a newer term. So food security really means calorie security or protection against hunger, which you and I both know doesn't necessarily mean that those calories are nourishing and providing the nutrients needed for that person to thrive. So that's what nutrition security is we're actually giving you the nutrients to thrive. And that looks very different than here's a bag of Cheetos and you're not going to be hungry, but now you've got fruits and vegetables. So looking at the process here, the first White House Nutrition Conference was over 50 years ago, and it was in response to Americans' outcry when they realized how many people in our country are still without adequate food. And that led to some of those federal programs I mentioned really getting invested across the United States. We have a long way to go still. So the White House held another nutrition conference in the fall, and I appreciated the approach that they took, which they said, here's what we're going to do in terms of federal policy. An example being expansion of Medicaid coverage of food as medicine in certain states. So they are piloting in states such as California and North Carolina are two of the states that are piloting certain food as medicine interventions that are covered by insurance, saying, hey, we should pay for food like we pay for a prescription. And that is rolling out and being actively studied. So we'll understand how much benefit that brings in the next couple of years. And then the next piece of this was, we can't do this alone. The problem that we face with diet quality as the number one risk factor for early death in the US requires everyone at the table. So we need businesses, including the food industry. We need innovators. We need people who are creating strategies to educate that are technology based. And so they made a call for everyone to come to the table and say, what are you going to do? How is your organization going to help? And that includes medical education. So we now have a federal encouragement for medical educators to change the way that doctors learn about nutrition, so my experience isn't repeated. And actually next week, the directors of the American groups that govern medical school and residency training in the US are convening in Chicago to decide how we're going to change nutrition education for doctors in America. So I'm really excited that we're going to make progress hopefully next week with that. But it's a combination of our federal programs, our private sector businesses, and those who educate others. We all have a lot of work ahead of us.
Yeah, but that's, gosh, great news. I mean, great news to hear.
Absolutely.
So, we hear a lot about value-based care and paying for outcomes. And I know, being a nurse, that referrals to dietitians and nutritionists are not always happening, especially around that whole nutrition component. So all of this plays such a critical role in improving clinical outcomes. So what role does value-based care have in impacting the changes needed to secure nutrition security, and how can technology and innovation be integrated to support and enhance existing care?
So there's several things to unpack there. I think first, let's go to what value-based care actually means. It means I actually want people to be well for the most responsible investment. And that is not American healthcare right now. We have a sick set of human beings in our society getting sicker by the day, and we're spending way too much, but people aren't actually getting better. So I really see value-based care as a hopeful change in the narrative that we're back to this. The primary goal is not for us to spend more money, but for us to save money and really bring the best outcomes. And food is the perfect example of applying that, because what it costs to actually have nourishing food is significantly less than most of the health interventions that people who have diet preventable disease are having. So I think that we start with it goes back to physician education, that if physicians are not educated to understand the pivotal role that nutrition plays, they're not going to be referring to dietitians and nutritionists. And dietitians and nutritionists have not been adequately valued in society as key team members. So how can we build models of acknowledging their expertise and then collaborating across physician and then other advanced practice providers with dietitians? And then I'll also bring in social workers and care managers who help ensure people are connected to the food resources they need to be successful. So I think all of that is going to help improve nutrition and security. And probably one of the best ways that technology can be part of this is knowing that we all carry a phone around, and the ability to use app-based technology to map out resources based on where someone lives. Zip code modeling and geographic modeling of where the needs are in different communities is best done with technology innovation. And so I think it's a really ripe area for people to get engaged and influence this.
Right. And also hotspots where the insecurity is and how we could target those and really, focus our resources a lot better, I think. All great points. But, change is difficult for everyone. And can incentives within these plans really favorably impact outcomes for both the plans, the health system, and the individual? So what are your thoughts on that? Because oftentimes we look at incentives for maybe the medical teams, right? Or the incentives for the plans, but really the accountability on that patient isn't always there, on that person isn't there. So how do we really include incentives across the board so that we can really see some of those really good outcomes for all?
So I don't think incentives are at all bad or without use, but what we understand about human habit formation and motivation is that the most sustainable change is made when we are intrinsically motivated, when it comes from something we believe matters and we are inspired to do it. And so I think about this a lot as an educator of junior doctors, that either a punishment, the stick, if you will, or a reward, the carrot, if you will, rarely leads to chronic long-term behavior change. I think it can help jumpstart it sometimes. But for individuals, I think they have to really make that connection and have a healthcare team and communication that says the best thing you can do for your health and longevity is to make lifestyle change. And we are going to give you these resources and make it easy to access and make the messaging around this clear to people so it feels like something they can practically put into their own life. And I think once an individual latches on to this, they can carry it forward in their own families. And story is probably the most powerful thing. So I actually think sharing stories of personal transformation that others hear and are inspired by is probably even more effective than a lot of incentives, because they see themselves in that other person's story and they want it to be their story too.
Yes, definitely the power of storytelling. I agree. When you think in terms of like outcomes and you think in terms of kind of like how people respond, I think the best thing really is follow-up. And I think where the healthcare system really falls short is follow-up, follow-up, follow-up. And we don't have that connection, because it's one thing when people are there and in front of you and they think they understand it, but when they go home and maybe they open the refrigerator door, or, it could be a money issue or whatever, it becomes really, really difficult. And I think technology could play a great role in really helping with that follow-up piece, because I think that that's really where you're going to see some of those long-term changes. And remember, change happens slowly, right? It's baby steps. But if you have a hand to hold or someone to help along the way, I think it really is helpful. So can you shed some light on kind of on your programs, and how is that follow-up piece being integrated, and do you think technology plays a role here as well?
It absolutely should, because I think, just the idea that comes to mind as we're talking about this is, what if you have an app where you can basically text a dietitian your questions in real time, and you can say, oh no, I don't have this ingredient for my recipe and I want it to be healthy. What do I do instead? Those types of things, the practical, that is probably the single biggest lesson that my work in culinary medicine has brought me, is that people need everyday practical support to do this.
Right.
And the misinformation out there abounds, and they are doing their best with a very messy messaging in our society. And so we as healthcare teams, we need to own the fact that our lack of messaging about this is part of what perpetuates the confusion. So how can we acknowledge limitations around what we can do in our healthcare systems, and then partner with different resources for people? So what we do right now is a couple of different things in the culinary medicine program. So we do electronic consults. So any physician in the system or nurse can consult myself and my dietitian partner, and we together respond to questions around food and nutrition as it intersects with health questions. Then we see patients for one-on-one coaching consults, where they actually come and see me first. And part of my role is to understand their journey and story around food, and also to process a lot of the harmful things that have been said to them by doctors about food, and the wrong things. And I'm working to change the way doctors are educated, but we have to process that baggage people carry before we can move forward. And then they meet with my culinary dietitian for practical strategies. So how do we scale that? So there's a couple of things. One, group classes, which can be done both in person and virtually around cooking, are exploding across the United States for a couple of reasons, because they teach you things, they are fun, and they build community. And food has to be about fun and deliciousness. And we have to re-message that a nourishing diet is not nasty food, it is delicious, and that it's part of our job to give people those tools. And then the follow-up touch points, I think there are so many open doors to study applications of how that looks. We are exploring the concept of a food navigator, which is a role of someone who has some nutrition knowledge and community resource knowledge that checks in with people and says, hey, have you tried shopping at this store? They have lower prices on the fresh produce. Or have you checked in with this organization where you might be able to get some support if you're struggling to get your groceries? And I think there's a lot of possibilities for connecting people in networks and communities, because that is really how we're going to move forward, is we do this as a community, not as individuals.
Absolutely. And food is personal, and it has to be really culturally who they are. And I think when you bring it to the communities, I think that happens. And I think that's really, really important. Really important. Awesome. So lastly, what's on the horizon for you? And are you optimistic that nutrition will be recognized as an equally important therapy as taking a pill or monitoring your blood sugar or your blood pressures? How, that prescription for nutrition, I think that that's going to be so important, because from my experience working as a nurse, and especially in communities, the power of the relationship between the physician, or it could be the minister in the church or whatever. But I think if we're all together with that messaging and that, prescription, however that is, I think you'd be able to really get people to really kind of like follow the plan and really become engaged around it.
People want to be well. They want to feel well. And we have done an inadequate job in helping them find the way. And so I will always be optimistic that anything that is going to change people's lives is going to eventually catch on. And I'm also trained in lifestyle medicine, which says going beyond nutrition, what are the pillars of a healthy life? And that means that we want longevity with health. We don't want to live to older age and then have a million health conditions that take away quality of life. So it's movement, sleep, stress management, and healthy connections in our community, avoiding risky substances. Those things all play in together. But the good news is that when the people around us are adopting these same behavior changes, the whole community rises. And I think that's where the power is at. I don't think it's in the health systems, really. We need to continue to innovate and to deliver the best possible evidence in ways that people can digest it. But then really it's our community centers and our faith-based centers, then the organizations that are going to pick this up and carry it forward. And it's the people in it whose lives are transformed that are going to lead to true change. And I'm definitely hopeful. Also, this next generation of doctors, they get it. And my generation missed it, but this generation is ready to offer their patients what's actually going to lead to true health.
Right. And I think there's been more of an emphasis on lifestyle. I think the last maybe 5 or even 10 years, there's been so much more around exercise and so much more even around nutrition. So I do think that these generations of physicians coming up will have kind of like it just be much more well-rounded and more natural to them than trying to kind of like fit it into something it's been totally unnatural. So I do think that there is hope as well. And I think the future is bright because I think there's so many efforts today. And I just want to thank you for all your passion, your work, and your commitment to this whole food as medicine movement and this whole nutrition movement. So thank you, Dr. Albin, for joining us. And do you want to share any last comments or words for our viewers?
My pleasure. I think I would say that it's easy to get overwhelmed when lots of change needs to happen, whether it's personal or societal. So you'd make one small change. And if you're trying to serve your community, you pick one torch to carry. And if we each do our part and move towards the right direction of better health and care of one another, we'll get somewhere. And so that might be as simple as switching out your snack today from the vending machine to a handful of mixed nuts or a piece of fruit. And those little shifts, research shows that makes a difference in your health.
I love it. Thank you so much. And thank you for joining Reimagine Health.
My pleasure.
The bigger vision of Reimagine patient engagement is to build a community of healthcare transformers working to improve patient outcomes. Patient engagement requires patients to be in the circle of care to ensure their care is holistic and not as a snapshot during a moment of crisis, but as a view that is ongoing, continuously enriched and deepening over an entire lifetime. So, to be part of this amazing community and contribute to the vision, reach out to us at www.connectedcarecircle.org. That's www.connectedcarecircle.org.